Hello and welcome. Today, we're going to dive into a topic that's absolutely fundamental to providing excellent care: oral health. For direct support professionals, this is so much more than just a daily task. It's a direct way to boost someone's quality of life. So let's get right into it.
We've all been there, right? Assisting with oral hygiene can sometimes be, well, a real challenge. So the big question we're going to tackle in this explainer is this: how can we transform this daily routine from something that's difficult into a consistent success for the people we support?
Okay, first things first, let's really get on the same page about why this is so incredibly important. We're talking about something that goes way, way beyond just having a nice smile. This is about overall health and well-being, period.
Think about it. When oral health is on track, it means avoiding all that awful pain and the complications that come with cavities and infections. It means someone can actually chew and enjoy all kinds of different foods, which is such a huge part of life. It boosts confidence, and at its core, it just makes life better and supports independence. Your role in all of this is absolutely vital.
You know, to provide great care, you have to understand the enemy. And in oral health, the #1 villain is this stuff called plaque. Let's break down exactly what it is and how it causes so much trouble.
So, what is plaque? Well, basically, it's a sticky film made of bacteria, living germs. And here's the really tricky part. It's often tooth-colored or even completely invisible, which means you can't always see the problem just by looking. It's this living layer of germs that's just constantly growing on the teeth, especially down near the gums.
The way it does its damage is actually shockingly simple. Just like this slide shows, when the bacteria in plaque get to munch on sugar from the food and drinks we have, they produce acid. This simple formula, bacteria plus sugar equals acid, that's it. That is the root cause of almost every single dental problem out there.
And this image right here shows you exactly where that plaque loves to hide out. You can see it collecting right there along the gum line. This is the critical zone we have to focus on during cleaning, because that's where the acid just sits, right up against both the tooth and that sensitive gum tissue.
So what does all that acid do? Well, it launches a two-pronged attack. When that acid sits against the gums, it causes inflammation and gum disease. And when it sits against the tooth, it literally eats away at the enamel, causing tooth decay, what we all know as cavities. Both of these huge problems come from that one simple formula.
Okay, knowing the science is one thing, but let's be real. Putting it into practice can be tough. It's so important to acknowledge the challenges you face every day. Let's identify the 3 main barriers that can get in the way of providing effective oral care.
We can pretty much sort these obstacles into 3 main buckets. First, you've got your informational barriers, where someone just doesn't know how or why to brush properly. Second, there are physical barriers, where a disability might prevent them from actually doing the task. And third, you have behavioral barriers, where a person is able to do it, but they resist or refuse. Once we know which barrier we're up against, we can make a plan that actually works.
All right, now that we've named the barriers, it's time to open up our toolkit. This section is all about practical solutions, the real how-to for knocking down those obstacles and delivering amazing care with confidence.
Okay, the technique itself is so crucial. First, just wet the brush. And here's something that surprises a lot of people. You don't actually need toothpaste to remove plaque. It's the physical action of the brush that does the heavy lifting. Place the bristles so they're half on the tooth and half on the gum. Then, and this part is key, angle those bristles at 45 degrees, pointed right toward the gum line. Use little circles to clean every single surface and shoot for at least 2 full minutes.
And this picture shows that critical 45-degree angle perfectly. See how the bristles are pointing right into that little pocket where the gums meet the teeth? That's the magic move. That's the technique that physically breaks up and sweeps away that plaque buildup we saw earlier.
For physical barriers, there are so many simple adaptations we can use. Things like floss holders can really help with dexterity. And honestly, an electric toothbrush can be a total game changer. Don't be afraid to move out of the bathroom. A couch or a recliner might provide a much more stable and comfortable position. Even simple things, like adapting the toothbrush handle, can make a world of difference.
I mean, just look at these solutions. So simple, but so smart. Pushing a handle through a rubber ball or adding a bicycle grip can instantly make it easier for someone to hold and control their own toothbrush, giving them way more independence in their own care. And positioning is key, not just for the person you're supporting, but for you too. Standing or sitting behind the individual, like you see here, lets you gently stabilize their head while giving you a clear, direct view into their mouth. It's safer, it's more comfortable for everyone, and it's way more effective.
So we have the techniques, we have the tools. Now we need to wrap all of that in a process that makes sure everyone stays safe. Let's walk through the absolute non-negotiable steps for infection control. Think of this sequence as your blueprint for every single session. It all starts with preparation. Get your supplies out first, then wash everyone's hands before you even think about putting on your protective gloves. After you assist the person and help them rinse, the key is proper cleanup. Supplies go right back into their personal container, and you take off your dirty gloves the right way. And how does it end? The exact same way it started, with a final, thorough hand washing for both of you. Following these steps every time is absolutely critical.
And you know, this quote just nails the heart of our mission. It's a delicate balance, right? Our job is to encourage and empower as much independence as we possibly can, while also stepping in to make sure the job gets done right and that person has great oral hygiene.
So ultimately, every single technique, every single strategy we've talked about, it all serves one central goal. We are not just cleaning teeth, we are empowering people to take part in their own health and their own well-being.
So as we wrap up, I'll leave you with this question to take back with you. Based on everything we've covered today, what is just one new technique, one small adaptation, or maybe one different approach you can try to empower a little more independence in oral care for someone you support?